It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I answered a question from one of our readers of our blog, and the question last week was tracheostomy and weaning off the ventilator in ICU. How long can it take? You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to shine the spotlight on the numerous issues that go along with long-term intensive care when patients require long-term life support or long-term high acuity care for chronic conditions. Therefore, in this week's blog, I want to discuss if you want good nursing care in your own home instead of intensive care, you have to be brave enough to point out what goes wrong in ICU. Hundreds of adults and children in intensive care in Australia and dozens of patients at home on life support already need intensive care at home services instead of staying in intensive care for either way too long than necessary or, on the other hand, get sent home with inadequate or inappropriate support, or sometimes no support at all. Intensive care units also need to stop to inappropriately issue NFR, not for resuscitation, or DNR, do not resuscitate orders for patients on long-term life support because they can't see any perceived alternatives for those patients. Premature and inappropriate NFR or DNR orders, as well as premature withdrawal of treatment decisions that are quote-unquote framed as being quote-unquote in the best interest of a critically ill patient on life support without giving patients and their families a genuine choice and a genuine alternative to long-term stay in intensive care and or the option of an end-of-life situation at home instead of intensive care are highly inappropriate and highly unethical from my point of view. And I don't say this lightly, and I also need to explain that after nearly 20 years intensive care nursing, as well as intensive home care nursing experience in 3 different countries, I have seen my fair share of different approaches, but I therefore also know what solutions that work. The solution that works for long-term intensive care patients, adults and children is intensive care at home nursing, because we bring the intensive care nursing skills into a client's home and we improve our client's quality of life whilst reducing the cost of an intensive care bed by more than 50%. But also giving people choice and the right to live in a first world country need no further explanation as far as I'm concerned. Furthermore, legislation in Victoria and Australia is changing in March 2018, and it'll give health consumers a choice when it comes to end-of-life decision-making. The legislation will be more health consumer focused and will give people a choice, and it will move away from the current one-size-fits-all approach that most intensive care units use. For more information about the upcoming changes in Victorian legislation, I have put a link below this video in the written version of this blog, and you can click on it to get more information there. The patients and their families that I'm talking about are extremely vulnerable individuals who are reliant on one-on-one specialized intensive home nursing care because they require tracheostomy care, mechanical ventilation, sometimes non-invasive ventilation like BiPAP or CPAP, sometimes home TPN, which is intravenous nutrition, sometimes seizure management or unstable airway management, even if they don't require mechanical ventilation as such. The majority of intensive care health professionals still have limited understanding what is possible in a home care environment because they still think the only exit doors for an intensive care patient, so to speak, are either to go to a hospital ward or to die. What a limited mindset and what limited thinking in the 21st century, especially since there is plenty of evidence here in Australia, as well as in Germany, that intensive care at home is a successful model of care that provides win-win situations for all stakeholders. Every individual, whether adult or child in intensive care requiring long-term life support, has their own life story, their own personality, their own life goals, and each individual in such a situation requires tailor-made solutions that are applicable to their own individual situation. And those solutions for the individual and their families are not available in intensive care. The solutions, however, are available when we bring our intensive care at home nursing skills into our clients' homes. That's where we can make the biggest difference. Here at Intensive Care at Home, we are extremely proud that we can enable our clients such tailor-made solutions to improve their quality of life, and in some instances, quality of end of life in their own home instead of intensive care. We are also extremely proud that we consistently and predictably keep our clients out of intensive care, pediatric intensive care, or sometimes neonatal intensive care, because our staff embrace and live and breathe the concept of intensive care at home every single day. The reality is that most of the intensive home care nursing care delivered is happening behind closed doors. Therefore, it is difficult for other patients, families, as well as intensive care health professionals to understand how it is being delivered on a day-by-day basis. Most intensive care health professionals still live in the dark ages, and they have no understanding that sending intensive care or pediatric intensive care unit, as well as neonatal intensive care unit nursing skills to a client in the home who is life support dependent is making all the difference to their and their family's quality of life. In fact, we are the first accredited intensive care at home nursing service provider in Australia who sends intensive care nurses in people's homes to maintain their quality of life on life support. So if you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, also out of nursing homes, or if you find that you have insufficient support for your loved one at home on a ventilator, or if you have any questions, just contact us on one of the numbers on the top of the website. Also, check out our careers section. We are currently hiring intensive care and pediatric intensive care nurses for clients in Melbourne, Sunbury, and in South Gippsland in Victoria. We are also an NDIS, TAC, and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program earlier this year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.